We now return to Toronto's Kensington Market for a conversation with the Prime Minister.
Canadian healthcare may be sick, but for the provinces, the prescription is a dose of federal money.
We all want to know that when we go to the hospital, we will receive the help we need.
There's always a deal to be had, but we're all focused on delivering the best healthcare system for the people of Ontario and Canada.
I think it's important that we keep on looking for a meeting between premiers and the Prime Minister.
We are committed as a federal government to investing significantly more in our healthcare system.
If we don't see action on healthcare, we absolutely preserve the right to withdraw our support. This is very serious.
We have seen a crisis in this country when it comes to hospitals. Children are being airlifted hundreds of kilometers away for treatment. Canadians are having to wait hours for emergency care. And there is also a critical supply of medication. But the fact that we got to this level in the first place in this country has surprised a lot of people, because this is, of course, a G7 country where people have expectations for a certain level of care. A lot of people are saying this is a life and death issue, the crisis in hospitals, but it isn't being treated like one.
As we all learned during the pandemic, there are very different responsibilities when it comes to what a federal government can do and what a provincial government can do. Provincial governments are in charge of delivering health care. The federal government helps fund the provincial healthcare systems across the country to make sure that everyone gets the same high-quality, free healthcare that they need. Right now, we're seeing that our healthcare systems are strained, if not broken, right across the country in many, many ways. But as the head of the Canadian Medical Association said this past summer, you can't fix something by just putting money into a broken system. We're going to be there to send billions more on top of the record amounts that we've sent to the provinces for healthcare. We're going to send more. But we need to see real improvements. We need to see results and outcomes that means that kids aren't waiting in hallways or being airlifted across the province, that seniors aren't continuing to face under quality care. We need to see transformations in our system. And yes, the last thing anyone wants to see is the federal government fighting with the provinces over, oh, it's your fault, it's your fault. Nobody wants to see that. They just want it fixed.
What is the interim solution? I mean, you haven't even sat down to meet with the premiers, which is something they all want. Will you be doing that in 2023?
The solution that the federal government has is to send more money to the provinces. And that's not the result that Canadians want. The Canadians want more and better care, better healthcare workers, better, more rapid recognition of credentials. These are things that Canadians need. And right now, by saying provinces need to come to the table, willing to make a deal, willing to say, yes, we're going to be accountable for any more money that comes into it to results for Canadians, is the kind of thing that's going to solve this. And because as I've talked to nurses and doctors and frontline workers in our healthcare system, they've all said, make sure the provinces are actually delivering better care in exchange for the money that the federal government continues to send them. And that's what we're going to do.
I want to move on to your government's commitment to reconciliation. There are about 300,000 children in this country who are still waiting for First Nations child welfare. Your government's proposed gun ban, Bill C-21, which has evolved into something far more expansive, has drawn criticism from the Assembly of First Nations, who say it would unfairly impact hunters who live off the land. How do you respond to those people who say that despite your government's commitment to reconciliation, it's missing the mark?
We have moved forward in deeper and better partnerships with Indigenous peoples in a respect-based way, in investing billions in ending 137 long-term boil water advisories. There's about 30 left, but each of them have a plan and a project manager and the funding to lift them, so we're on the right track on that. On the guns issue, it's an important one, and we need to consult more and work with Indigenous communities on that to make sure they understand we're not going after any of their traditional rights to hunt, because obviously hunting is a huge part of life for many, many Canadians, not just Indigenous, and we fully respect that, and we're going to protect that. But when we brought in our ban on assault-style weapons 2 years ago, We knew that manufacturers would keep updating their lists and trying to get around the ban with new models. And we have to make sure that that ban continues into the future. Nobody wants assault-style weapons anywhere in this country. Don't use them for hunting, and you shouldn't have them for any other reason. So we created a definition and a list that goes with that definition of the kinds of characteristics that means these are assault-style weapons that just won't be allowed in Canada anymore. Now, you can imagine that there are some weapons that are used for hunting that unfortunately fall on the wrong side of the line. Not many, but there are some that are slightly overpowered or have too large a magazine capacity, or technical reasons like that, including some of the guns that are often used by Indigenous hunters. So our focus now is on saying, okay, there are some guns, yes, that we're going to have to take away from people who were using them to hunt and say, but we're going to also make sure that you're able to buy other guns from a long list of guns that are that are fine for hunting and you know, whether it's rifles or shotguns. We're not going at the right to hunt in this country. We are going at some of the guns used to do it that are too dangerous in other contexts.
On the issue of the compensation, I was speaking to an Indigenous advocate who was saying we have had to litigate our way to success. Why are there still 300,000 children and families still waiting for compensation? Why is that such a battle still?
We agreed with the Indigenous organizations to compensate to the tune of $20 billion. Children who'd been, people who were mistreated as children in care. So we took it out of the courts. We took it into negotiations. We found a number that works for everyone, and we want to get that money out as quickly as we possibly can, and that's what we're doing.
When we return,
There has been so much international pressure against Vladimir Putin, but he remains entrenched. What do you think it'll take?
when a conversation with the Prime Minister continues.